Right, so we definitely had to start this off with some uplifting music. Thank you to my colleagues, Katari and Sylvia, for letting me know that today is actually Uplift Someone Day, National Uplift Someone Day. So if you also want to in the chat, you can share someone that you're uplifting today, someone that's motivational in your life. Maybe you're a Yankee fan and you're feeling uplifted that last night you got a win. Listen, it's great to be here on this Wednesday with everyone, and we have a great presentation and conversation ahead for everybody. So what really drove wanting to have this conversation was, weight loss is a very sensitive subject in our society. This could be due to several reasons, ranging from socioeconomic issues, traumatic lived experiences, and or underlying medical conditions. So what we wanted to do today is draw everyone's attention away from Dr. G, and this is in the words of a good colleague of mine, Solomon, aka Google, and have a transparent conversation with one of our physicians here at Mount Sinai Health System, who is doing some amazing work in the area of weight management. And that is Dr. Jennifer Ng. She is an experienced primary care physician and board certified obesity medicine specialist who currently works at Mount Sinai Primary Care Faculty Practice Associates, both as a primary care physician and also as an obesity medicine specialist, seeing patients for weight management. She is passionate about working with her patients to help them develop healthier lifestyles. She currently serves as associate editor for Obesity Pillars, and is also formerly a contributor to the Obesity Medicine Association's treatment algorithm for adults, and formerly the chair of the OMA's outreach committee. And she also has been recognized for her contributions and dedication to the field of obesity medicine. She has been honored with the prestigious title of Fellow of the Obesity Medicine Association. Everybody, please welcome Dr. Ng.
Hi, everyone. Thank you so much for having me here today. So let me just share my screen, and then we can get started with the presentation. So give me one moment. All right. Can everyone see my screen? I just want to make sure that you can all see it.
Yes.
Okay, excellent. All right, so let me start this slideshow. Okay, so as Sean already mentioned, we're going to talk about GLP-1 medications and health, and that's like the new kind of hot topic in medicine right now. Okay, and so it's just some disclosures. I'm affiliated with the Obesity Medicine Association. I did give them one talk recently, and they gave me a small honorarium, which is a fee for speaking, to just reimburse me for traveling and speaking to the people at the conference there. Otherwise, I'm only paid by Mount Sinai, not paid by any other entities. And so on the agenda today, we're going to talk about GLP-1 medications and what they are, how they work, as well as what kind of benefits they have for things like weight loss, diabetes, as well as other health conditions. And finally, we'll end with what to do if you are interested in these medications. Okay, and so first we're gonna talk about like kind of the science behind all of this. And so GLP-1 is actually a gut hormone that is found in the body. It's called glucagon-like peptide 1, and that's what it stands for. And this hormone actually helps to increase insulin secretion from the pancreas when glucose is present. So meaning after you eat, when insulin levels are supposed to rise to help you digest your food, then this gut hormone is naturally released. Okay, and so the GLP-1 medications work by binding to the same receptors as the GLP-1 that's found in the body. Okay, and so it produces similar effects basically as GLP-1 itself. And so the reason why we don't just rely on our own bodies GLP-1 to do all these effects is that GLP-1 is actually very rapidly degraded by a enzyme in the body that basically breaks it down so that it doesn't continue to act after a certain amount of time. And so there can be some natural like disruptions, like some people have issues with GLP-1 production or like how long their GLP-1 effects last for. And so there are actually some people who have some issues with this. And so the medication can actually help to, boost these effects. And so because, it's, as you can see, it is used to help to increase insulin secretion after a meal. Naturally, it helps with diabetes. And so the first GLP-1 medication ever approved was used for diabetes. And that is exenatide, which is also known by its brand names Byetta and Bydureon. And that was first approved by the FDA in 2005. So, there's been a long history of use of GLP-1 medications as well as research into this area. And of course, subsequently, there was also other effects that was found that GLP-1 can do, including decreasing food intake and appetite, slowing down stomach emptying, and increasing satiety in general. And so that means that, it naturally can help with weight loss. And so as these pharmaceutical companies started doing more research into this and more studies, basically, while they were testing, another medication for diabetes, they also found that, it helped with weight loss as well too. And so then there came the first GLP-1 medication approved for weight loss, which is called liraglutide, known under the brand name of Saxenda, and that was approved in 2014. And then, the latest iteration is that there is actually a medicine called tirzepatide that was recently discovered. And it actually binds to both GLP-1 and GIP receptors. So these are two gut hormones. So instead of binding to just one, this medicine binds to two receptors, okay? And GIP is another gut hormone. It's called glucose-independent insulinotropic polypeptide, which is a mouthful, and GIP is generally how we refer to it. And this gut hormone does similar effects to GLP-1 by helping to increase insulin secretion after a meal as well. So it's also helpful for diabetes. But interestingly, what they found was that this hormone does something a little bit different as well. It also binds to brown adipose tissue, which is brown fat. And by its binding, it helps to increase metabolic rate. And so we'll go on a little bit of a diversion here. So just to briefly explain why this is important. So there's two different types of fat in the body, and that is the brown fat and the white fat, okay? And so white fat is, what we traditionally think of when we think about fat is that it's the storage kind of excess nutrients that the body has. So when you eat, if you have too much of certain nutrients that the body does not need at the moment, then it is actually saved by the body and stored as fat. Okay, and that's white fat. And it also produces, various hormones that help to regulate nutrients as well, too. So it's a hormone producing tissue. And then there's brown fat, which is actually used to turn the nutrients that you eat into energy that is like turned into heat. Okay, and so instead of storing this excess, I guess, nutrients for later, it just uses up, turns it into heat, and then it basically gets released back into the environment as heat, and so it does not stay in the body. And so as you can see, if you have more activity in the brown fat, then more of the nutrients that you take in is kind of burned up and leaves the body as heat, basically. So then you don't have it being stored, which is also helpful in weight management. And so it turns out that when you bind both of these gut hormone receptors, you have synergistic effects, meaning that the medications work better when they target both than when they just target one gut hormone. Okay. And so, so let's now talk about GLP-1 medications and weight loss. And this is something that has been in the news recently a lot because it is something that has been shown to work really well, and many people are taking it, including celebrities. And so first we want to talk about like who qualifies actually for weight loss medications in general, not just like GLP-1, but in general weight loss medications. And so I'll kind of start with defining body mass index, which many of you are likely familiar with, because if you go to see your doctor and they take your height and weight, then they can calculate out what is called the body mass index. And that's actually measured in kilograms per meter squared. So it's your weight over meter squared, your height squared. And so, and this gives a number. And so 25 and above is defined as overweight, and 30 and above is obesity. And so you can see that, just being like having the condition of being overweight does not automatically qualify you. You have to have at least a body mass index of 27 and also weight-related complications. So things like diabetes, sleep apnea, fatty liver, high blood pressure, high cholesterol. All of these things can potentially be weight-related, and so they would all fall into this category. And so having at least a body mass index of 27 and one of these, I think two actually of these complications will qualify you for weight loss medications. And of course, if you have a body mass index of 30 and above, you don't need to have any weight-related complications that automatically qualifies you. And the reason for this is that, your risk of health issues does increase as your body mass index goes up. It's not for everyone, but like for many people studied, this was the case. And so that's why they set the definition as, people needing weight loss medications with this criteria. Unfortunately, the insurance doesn't necessarily cover weight loss medications, even if you meet this criteria, mainly because they don't always consider it to be medically necessary. And one of the issues is, of course, that Medicare, which often sets the standard for many insurances, doesn't actually cover weight loss medications, which is unfortunate. I mean, there is one caveat, which I will go into later. But because Medicare sets the standard, so then that's like the lowest bar for the insurance. And so there are insurances who don't cover any weight loss medications. Some cover certain ones and not others. So that's always a big hurdle in using medications. And so let's say if you're lucky and the insurance agrees to cover a medication. So there's different GLP-1 medications. And I already kind of mentioned this is the first one that was, I guess, discovered and approved for use in weight loss, and that was liraglutide, also known by its brand name as Saxenda. It has to be taken daily, unfortunately, so is a little bit of a hurdle in using it, giving yourself a daily injection. And then subsequently, there were also weekly injections that were discovered, and that was semaglutide, also known by its brand name of Wegovy, and tirzepatide that I mentioned earlier, also known by its brand name Zepbound. And so, let's go into some of the common side effects. And so, as I mentioned, these medications, they work on the gut hormone receptors, right? To increase the effects of the gut hormones. And so naturally, you can see that a lot of the side effects are gut related. So things like nausea, vomiting, constipation, diarrhea. And so, if you think about how the medication works, right, it slows down stomach emptying, which then naturally, if things are not moving forward as much, you're going to get constipated. And then it's also more easy for it to come back up the other way, right? So back up through your mouth. And that would be then that would produce nausea and vomiting. And then the diarrhea, that seems, a little bit more mysterious, but that seems to be more so in patients who are taking tirzepatide, which is the 2 receptor targeting medication. And so it might be more related to the GIP side of things. Okay, and then, who should not take these medications? And that's people who have a history of a syndrome called multiple endocrine neoplasia 2. And this is basically a genetic syndrome in which you tend to form tumors in your thyroid and also in your adrenal glands. So both are hormone-producing glands, okay? And so people who have this cannot take the medication, as well as people who have a personal or a family history of a special type of thyroid cancer called medullary thyroid cancer. Okay. And so these are the two absolute contraindications. So there are some other concerns, that if you have like some of these other conditions that we need to be a bit more careful. For me personally, if someone has a history of pancreatitis, I would not prescribe them the medication, mainly because GLP-1 medications have like a small association with increased risk of pancreatitis. So, if someone's already has a history, we don't want to make anything worse, okay? And then gallbladder issues. So in general, when you lose weight, you can actually, especially if you're losing weight rapidly, you can get gallstone issues. And that can lead to like infection in the gallbladder or inflammation in the gallbladder, and also pain after you eat in general. And so, we know that, weight loss in general can cause this. And so these medications can lead to very significant weight loss. And so that might make this worse. So if someone comes in and they, have a history of this, we would, of course, discuss, the potential risk of this worsening while the patient is on the medication. And sometimes, we would even discuss maybe that someone should take their gallbladder out before they start taking the medication, because we, depending on if their gallbladder issues are like very active, then, we don't, as I said, we don't want to make anything worse. And finally, things like kidney problems. We're cautious about that mainly because, if you are on this medication and you have a lot of issues with nausea, vomiting, diarrhea, you can lose a lot of fluids that way. And then, any loss of fluid can exacerbate someone's already pre-existing kidney problems. So we can use it, but we use it very cautiously, okay? And, I know we now that we've gone through all these like, side effects and, kind of potential issues with the medication, I don't want to scare anyone from taking the medication because they're very, very good, but they just should be taken under medical supervision. And, in studies on the GLP-1 medications, the weekly injections have been shown to help with, between 15 to 20% weight loss, and the daily injection about 10%. So they can, help with a significant amount of weight loss, so they can be very beneficial in the right person. Okay. And now, moving on to GLP-1 medications and diabetes. As I previously mentioned, GLP-1 medications were originally intended to be used for diabetes, and this is its first indication. And so there's been a long history of GLP-1s in treatment of diabetes. And so there are multiple different versions of these medications, including like daily medications, both the exenatide, which is the first one that was discovered and approved in general for GLP-1 medications, known by its brand name of Byetta, and then the liraglutide, which, if you remember from my previous slides, is also used in weight loss. In weight loss, it's known by the brand under the brand name of Saxenda, and in diabetes, it's known under the brand name of Victoza. And it turns out that in diabetes, you actually use lower doses of a lot of these medications as compared to when you use them for weight loss, mainly because the effects on the on sugar control kind of hit a ceiling at a certain dose. Okay, and so just to clarify, exenatide is not used for weight loss, nor is dulaglutide. It's only the liraglutide, semaglutide, and tirzepatide that are used for both. Okay, and there's some thought that maybe it's because these like three specific medications seem to have more effects on the brain, so it has better weight loss effects, and so that's why they were approved for both diabetes and weight loss. Okay, and then there is one medicine that is a daily medicine for diabetes, that is actually not an injection, but it's still a GLP-1. And this is the oral version of semaglutide, which is called Rybelsus. And this is only used for diabetes. Okay. And then there's weekly medications, as I mentioned, exenatide, dulaglutide, and then of course semaglutide, which is known by its brand name as Ozempic, or tirzepatide, which is known by its brand name as Mounjaro. Okay. And so there are, other health benefits to GLP-1 medications that the pharmaceutical companies are currently exploring. And so one of the major things is, heart disease and stroke. And so recently, the FDA did approve the weight loss medication Wegovy, which is semaglutide, for patients who have a history of heart attack and stroke, and also have the condition of being overweight. Okay, and so that's like a major kind of approval, because this means that also Medicare patients can take it for this indication if they are both having the condition of being overweight and also having a history of heart attack and stroke. And so this is one of the only it's the only medication, I would say, that Medicare will approve for weight management. No, though not specifically for weight management, but more so to reduce the risk of heart attack and stroke. Okay, and if you look at how this occurs, we know that besides, reducing weight and blood sugar, that GLP-1 also has effects on reducing cholesterol and inflammation. And this is through its basically its effects on the different tissues in the gut. Okay, and it also has effects outside of the gut in various other body tissues, including the heart and the blood vessels. It provides protective effects on that, and also reduces blood pressure. And so you can see why that this, like with all these effects, that this would be like helpful in reducing things like heart attack and stroke. And there's also, I had mentioned, there's also, effects on the brain. There are GLP-1 receptors on the brain and the nervous system. And it similarly provides protective effects on the nerve cells. It also decreases addictive behaviors and reduces food intake and appetite via its binding in different parts of the brain that control weight and appetite. Okay, and there have also been noted in various research effects on the immune system, the kidneys, and the lungs. Seems to help to improve kidney function in general. And so I'm sure that there's a lot of research also looking in, what can GLP-1 medications do for these or other organ systems. And so stay tuned about that. And now I just want to show you some recent kind of headlines about GLP-1 medications in general. So, as I mentioned before, there are receptors in the brain. And so, there's been some evidence in studies that show that the active ingredient in Ozempic and Wegovy, which is semaglutide, can help to reduce risk of Alzheimer's disease. So that's a very interesting finding. And so that's something that's currently being explored. And as I mentioned in my previous slide, it has many effects. GLP-1 in general has many effects, including on the brain, the blood vessels, and a lot of the other cardiovascular risk factors. And all of that actually goes into someone's risk for things like dementia, because anything that can potentially interrupt blood flow to the brain, as well as affect inflammation in the brain itself, can help with reducing dementia risk. Okay, and we know that these medications can help do that. So this is something currently being explored. And and then also for tirzepatide, which is one of the other medications, the one that I mentioned, that helps to that binds like both gut hormone receptors. And this one has also been found to reduce the severity of sleep apnea. And as you can see, very impressively, they say that up to 51.5% of the people who took it in the study basically a resolution of their sleep apnea. So that's pretty significant. I'm sure that, they're going to follow up with more studies and, see if they can get FDA approval for use of treatment in this indication. And then tirzepatide is also being explored for its like heart protective effects. And it showed benefit in a study for adults with heart failure and who also had obesity as well too. And so a lot of different, kind of research going on right now to just try to see what other things that GLP-1 medications may be helpful for. And it is actually, GLP-1 medications are currently being used off-label for treatment of fatty liver. So there's something to keep in mind. Okay. And now I just want to talk briefly about compounded medications. If you've ever, kind of gotten an online ad for things like Wegovy or Ozempic or Mounjaro, Zepbound, advertising that there are cheaper versions of the medication that you can get online, that's generally likely going to be a compounded version of the medication. Because the medications out of pocket would cost like over $1,000 a month. And so if the insurance doesn't cover it and, there's kind of an online ad that is kind of, saying that they're going to provide a lower cost version, it's typically not going to be the original medication that was produced by these pharmaceutical companies, but rather a compounded version. And so compounding basically is when, a special pharmacy called a compounding pharmacy makes a version of the medication. And they can do that because the medication is under shortage. Typically, a lot of the medications are under patent. So that's why, like, a lot of new medications are like brand name and there are no generics because it's under patent. Until the patent expires, then generic versions cannot be created. And so you only have the brand basically. And compounding is kind of something similar where like in terms of similar to generic that they make a version of the medication. But the problem is that the FDA, which you can see here in this alert, is that the FDA does not actually regulate this. They don't study it and test it in the same way they would before giving approval to the official like version of the medications made by the pharmaceuticals. And so now there's been, given that there's growing use of compounded medications, there have been like increasing number of issues. And this alert says, about that there has been some dosing errors associated with the compounded medications, and people have had to be hospitalized, had a lot of side effects and things like that. So the FDA just wanted to alert, healthcare providers and patients to know that, this is a concern. And when the compounded pharmacies make the medication, a lot of times they will put the medication, in a big vial. And so you have to like slowly administer yourself, like, the dose of the medication. And that is, problematic because, if you draw up too much and you accidentally give yourself too much medication, you can have a lot of side effects. And that could be a reason why people have been hospitalized. And so the FDA basically said, FDA-approved drugs do not undergo FDA pre-market review for safety, effectiveness, or quality. So they pose a higher risk to patients, and they caution about using compounded drugs. And so, so just I would say be careful if you see these ads or you decide to go with an online program. It could be possible you're getting a compounded version of the medication, which could be less safe. Because they might add other ingredients in to the medication which are not tested because the original version does not have these ingredients, and the compounding pharmacy is not required to test their medications. And also compounded versions of the medication can contain different like chemical forms. So if we think back to chemistry, which is probably a while ago for many people. So there's like acid, base, and salts, right? So base, the original version of the medication for semaglutide is a base. And a lot of the compounded versions will use a salt form. So that's actually chemically different, even though it's similar in molecular structure. And so that could produce some other effects that we don't know about. And because this has not been studied, it can be, not as safe to take. Um, Okay. And so finally, I just wanted to, kind of end on talking about like, not forgetting to also work on things like your diet, your exercise, sleep, and stress management. Medications are very good and helping people with weight management, as well as diabetes, but does not replace things like diet, exercise, sleep, and stress management, which I know are not easy to like, kind of incorporate and work on all these things. But, they are important in health conditions in general, not just for weight management. And, the main thing is to remember that, this is long-term management. So, when you treat obesity or overweight, as well as other medical conditions like diabetes, this is kind of long-term care. And these medications are meant to be taken long-term. Like in the case of diabetes, people take them for life, right? And so because you have to take them for a long time, in order to see continued effects and also maintenance of your health, that should definitely be done under medical supervision, right? So you want to make sure that someone is always looking out for you, making sure that the medication isn't causing any problems to you, right? And so, finally, if you're interested in taking one of these medications, definitely look for someone who has experience using these medications. Someone either like who is an obesity medicine specialist or an endocrinologist. And I'll put in a slight plug for myself. So as Sean mentioned, I work in the Faculty Practice Associates Primary Care, and we're on 85th Street. Um, I am on the 6th floor. We have part of our practice on the 2nd floor as well. And this is, our office phone number. So if you're thinking about trying something, and you want to get a like kind of more comprehensive consultation, then, you can come to see me. I will say I'm not the only one in Mount Sinai who does this. So I'm not saying you have to come see me, but definitely you should see someone like a medical provider who has experience using this and who can follow you long term. Okay. All right. And, I'll end with that and, turn the floor over for any questions, basically.
Well, first off, great presentation, Dr. Ng. And, I apologize if your calendar is completely booked throughout the rest of the year, because after a presentation like that, I can see people probably running right now to my chart to get an appointment with you. But this was really good information. And I think you mentioned a lot of really good information where I don't think anybody's really getting scared by it because the
Mhm.
truth and the information is what's important because a lot of us are not aware of a lot of the information you just shared on this presentation. So I think it helps a lot of people make really informed decisions. As you mentioned, this is a very, very hot topic right now. So people are either ear hustling from people who are already on the medication, or
Mhm.
they might be resorting to some resources that probably aren't leading them in the best direction. So
Yeah.
I don't think anybody should be scared by that. I can totally resonate with the lack of insurance coverage. It always puzzles me that some of the best effects that can really help us be our best selves and have the best, I want to say, mentality towards life are not covered by Medicare.
Yeah.
So it then filters into all of the insurances. There may be cases where, if you're self-insured or your company's self-insured, maybe they will cover it for you. But we all fight the good fight. I guess on that subject, are you a
Mhm.
part of any committees that advocate for why this should be covered by insurances?
So I myself am not like specifically advocating, but
Yeah.
sorry, I am a part of the Obesity Medicine Association, which is a group of uh, you know, doctors, nurse practitioners, dietitians, who all like kind of provide obesity medicine care to patients around the U.S. And so there is a branch of our organization that is advocating at like, kind of on the government level in like DC in Congress, and we also have delegates in the American Medical Association. So this is a topic that's being brought up, and there's many different kind of, I guess, medical organizations that are trying to advocate for patients to get coverage for these medications, because we know that they are helpful. And it's just, getting insurance coverage can be so hard. And then people are turning to things like compounded medications, which are, and kind of unknown entity, because it's not been tested, and it's kind of like a wild west out there. Anybody who can make a medication, any kind of compounding pharmacy, they can make it, and then they can, because the medications are in shortage, they can, like, kind of, I guess you can say, sell it legally as compounded versions of things, like semaglutide and Wegovy and Ozempic and those kind of things. And so, so it's just that we're trying to, work on this. But as with anything with the government, right, like it takes a long time, and there are always, other priorities. And so it's just, I think, just being patient and just continue to work at it. And eventually, we hope that we can get things like covered by, at least by Medicare, because like I said, Medicare sets the standard for the insurances. And so if Medicare says, we're going to cover it, then, that's like the baseline, and so the other insurances will have to do something about it.
Absolutely. And I know anybody from the central billing office knows when you mention insurance companies, it triggers us a little bit. But
Yeah.
yes, we are always hopeful every day. So you spoke a lot about research findings during your presentation, and one of
Let
the
me just
questions.
unshare my screen for a moment,
Oh,
so that it's not distracting to everyone. Let me see. Did I? Oh,
no,
actually, I
you.
had shared my screen already. Okay.
Yeah, you're
That's
good. All right. So one of the questions we have here is about some of the research findings that when people stop taking one of these medications, they regain the weight, they lose preventative effects, and their spikes in blood sugar and cholesterol occur. Can you offer any insight on that?
right. So yeah, so the medication is very effective as a treatment, but it's not a cure. So it doesn't fix any of the underlying issues permanently. And so when you stop taking it, eventually it, like, kind of wears off, and is no longer in your system. And then what happens is, then the body kind of, like, the effects that the body had before kind of start to come back, the issues. And so as I think I mentioned it at the very beginning, but some people have problems with their own GLP-1, that's, they're resistant to it, or there's not enough being produced. And so, like, those things don't get fixed by the medication, not permanently. The medication just kind of helps to boost its effects in the body, like of GLP-1 and also GIP, depending on the medication. And so, unfortunately, if you stop taking it, people will, regain the weight back, or, start having issues with the sugars and cholesterol again. And so it's something that I mentioned is to be used long term, and in diabetes, potentially just for life, even. And so, unfortunately, we don't have any, like, I think there's not very good data yet, because these medications being used for weight management are pretty new. Like, as compared to medications that have much longer history, but that we just, will there come to be a point at which the body kind of changes to, like, this new kind of new state that you're in, like, once you've lost weight, and you've maintained it for, like, a kind of a long time, will the body kind of adapt to that, and then will there come a time when you don't need medications? I think we don't have a very good answer for that, but so far what we've seen is when people stop the medication, is that their body reverts back to its previous state. And so I think, just more research is being done. They're exploring, like, a lot more other types of medications to see, if they can better help with this, basically.
All right, fair enough, fair enough. So I have a scenario question here, and listen, you can charge me the copay, I'll take care of it, right?
Okay.
So the question here is, at a time, they stopped consuming breads, rice, and other starchy foods, and they noticed that their sugar cravings increased tremendously.
Mhm.
After introducing the foods back to their diet, their cravings never decreased. So they want to know if you can explain why this happened and whether this was their body's way of saying that this was not the right course of action for weight loss. And then the second part of that is, will these meds help with this issue?
Yeah, so cravings are something that is regulated by the brain, right? So we know that the weight regulation is very complex, and it's a combination of the gut and different parts of the brain together with that. And so cravings are generally something that basically if you take sorry, I'm losing my voice a little bit. Um, but so cravings are one of the things that like so it's like craving for anything. So if you've taken it before, whether it is carbohydrates or if it is alcohol or even like smoking with nicotine and then your body experiences a lot of kind of like pleasure in that, right? So it gives you like makes you feel really good when you eat it or do whatever with it. And then so that like kind of your body remembers that like and when you're feeling like you need a little pick me up, your body is like, oh hey, remember that last time when we did that, when we ate that piece of cake and we felt so good, we know where we can get that cake. So let's do that. Let's feel better. And this is a common thing, so it's nothing, how do I say, it's nothing wrong. Like this is, just you trying to feel better, like, right? So you're just looking for to feel good like you did before. And so sometimes like when you feel these cravings and you kind of deny them, like they just get stronger. And at some point, then then when you eat it again and you feel that like it kind of reinforces it, like you feel good again. And then, it reinforces this kind of cycle. And there are some scientists who think that this is, a problem of food addiction. And,
Mhm.
as I mentioned in my slide, one of my slides is that the medications help like decrease addictive behaviors in the brain. And it's interesting because I have some patients who are taking the GLP-1 medications and they say, hey, like they're like not that they were big like drinkers or smokers before, but they just said, hey, after I started taking the medication, I felt like I didn't really crave anything, like I didn't crave my cigarettes or my drink. Like I could go to a party and I was like, no, I'm just gonna drink water because I didn't really crave it. And so we know the medications can help with cravings. um we know that cravings are kind of like part of like what the brain's doing to just try to comfort itself, right? Like because it remembers, you know, feeling good when it did this, and that's kind of like it's more so the sensation that you remember that you felt good at that time, more so than the actual food itself. But you just know that it's associated in your brain, and so you seek it out. But if you kind of break that cycle, then a lot of times um, and it's hard to break that cycle. It takes like maybe a long time of not consuming that food or that substance in order to not kind of crave it. Um,
Yeah,
I hope this answers the question, but yes, but the medications can absolutely help. And sometimes, the cravings are just very strong and it's like, there's not too much you can do on it, like do with it on your own. So
yeah. For me, cookies are my nemesis. We battle every night, and right now, cookies is winning. I'm trying
these
though.
are winning.
Yeah, the cookies
Yeah.
are. I won't lie.
For
All
me,
right.
it's chips. I get a craving for chips, and it's so I don't stock my home with it, but
Yes.
obviously, in New York City, especially, like that they deliver groceries to you in like 15 minutes or whatever it is, and so
Mhm.
you like they just works against you, like the city. It's so many things are open 24 hours, so you can always get it if you want to, or they will even deliver it to you, so you
Yeah.
don't even need to leave your home. And so it's hard to battle that. So
Oh yeah, yeah. We can get very deep into that topic another time.
mhm.
Food insecurity when you go into certain neighborhoods, it's more fast food restaurants than actually
Yeah,
like organic foods. It's
right.
That's a whole nother subject. But you're
Right. We
absolutely
didn't even, as you said, we didn't even touch upon environmental factors, and we
exactly.
know that that is a big contributing factor to the rising like rates in obesity. And the hard part is getting how do you get the government to do something about that?
Yes. Yeah. Yeah. Absolutely. So another question for diabetics who after using these medications have a normal A1C. Uh, is it, once a diabetic, always a diabetic, you're on this medication forever, or have you seen some people actually come off the medication?
So it depends. So when someone's like, takes the medication and their A1C goes to normal, so we call that like, that really well controlled diabetes.
Mhm.
And the medication is indicated for maintenance, like, to continue to maintain that control. And so generally then if you stop the medication, then the the A1C can climb back up again. And so we generally, try not to mess with that because, we don't want people having uncontrolled diabetes and having complications from that. And so we will try to keep patients on it, to kind of just maintain. Sometimes we maybe try to reduce the dose to see if they'll maintain on a lower dose. Um, and I think, it's one of those medical conditions that you're always, if you've had it before, you're always going to be at increased risk for it, even if, let's say, it goes into what we call remission. That means that it kind of resolves for the moment. And so it's just that some people have more risk for these conditions than other people. And so that, it's always important to stay vigilant about it.
Yeah, absolutely. So our new enrollment information came out, and one thing that was clear in there was new for 2025, the mandatory Med Empower Fuel Healthy Weight Nutrition Program,
Mhm.
and the requirements for weight management medications. Can you talk a little bit about that?
I actually, one of my patients brought it up to me because, she was seeing me, and she, I'm treating her for weight management, and she actually said, "Hey, are you part of this program?" And I said, "No, actually, I also learned about it just like everybody else in the enrollment. I had seen it, and I was like, oh, interesting. That's something new that they're doing." Um, and so I'm not a part of the program. I'm not quite sure what they do other than like I think my patient was telling me she had been reading kind of up on what this was, and because it's mandatory, and it looks like there's some health coaching going on, like which is good. I think it could be beneficial, especially if it's a program that's provided and it's not going to cost you anything,
Mhm.
because as I mentioned, medication is only one part of the treatment. Diet, exercise, all of that is also important, and the medication does make it easier, for you to be successful in your diet, right? Because if you're less hungry, you're not having cravings, you're going to be able to like choose, better, healthier options. Um, and so in general, like the medication will also help with the diet part of things.
Mhm.
The exercise, also because like people feel more motivated when they are losing weight, that they want to keep this up. So they start doing more exercise and it gives them that motivation that they need. And so, I would say anything that adds to that is good for me. Like, it helps me with my patients. And, especially because health coaching is not something that's really readily available. And so if that's a service that, Mount Sinai is going to provide, that's great. I mean, or maybe they contract out to somebody that, but, either way, it sounds like they're going to provide that because it will be mandatory. So I think it's helpful to try it out. Like, and if it doesn't work, then, you only have to, I think, do it for a few months and not that long of a time. So,
Right. Yeah, or maybe Mount Sinai comes up with a fitness facility at the campuses.
oh, that would be great.
You
I
know
know
what I
now
mean?
there's like these
Yeah.
yoga classes, but like I think that's also it's either virtual or it's like, it's like a very small space. So, it'd be nice if there were fitness facilities available. I think making everything easier for people like
Yeah.
is always good.
Yeah, it's very different. Like, a lot of people, and, I was talking to a colleague about this yesterday who brought up a great idea. A lot of people have to leave the facility to go to the gym. You know what I
Right.
mean? And then they got to rush back, take a shower. I mean, for me personally, in the winter, it is the toughest thing because you're sweating, it's cold outside.
Hmm.
a week later, I'm seeing my primary care physician because I have a cold now, right?
Yeah.
So if there was something in the actual hospital to facilitate, maintaining or keeping up with weight management, I think the institution would totally benefit from that, and the employees as well.
Right. I mean, one of the hurdles for a lot of people is, you know, trying to find a gym facility, right? It's like if you don't have something near your home, like where you're gonna go, you're not gonna go out of your way to, to something that you have to take like several trains to get to, right? So, if it's right there, then you're more likely to do it. And I think that's a great idea. Just like maybe that's something that Sana can do, but um, I don't know how much that will take in terms of budget. And so, and where they'll find the real estate to do that.
Right.
So hopefully something that would be convenient for most of the most of us employees here. So,
Yeah. And I see Barbara put walking works as well.
mhm.
Absolutely. Absolutely. So hey, listen, we just missed Your Voice Counts, or maybe next year, y'all, when Your Voice Counts comes around, in-house facility for exercise. Let's all put it
Yeah.
in the comments. Let's see if we can probably push something for maybe 2026.
Yeah, maybe. I mean,
All
walking is great, just like she said. But one of the things is, strength training. I think like that's not something that people think about as much, because it tends to be associated with like, the gym bros, like the people who are at, at the gym and, lifting a lot of weights and, kind of hogging up some of the weights, right? So, but it's important for everyone. And I didn't actually mention this in my presentation, but when you lose weight with these GLP-1 medications, is you can actually lose a lot of muscle mass. And so strength training becomes very important because you need to like kind of you need to lift weights, either like body weight or actually resistance bands, or free weights or weight machines. Like you need to do something that increases the resistance against your muscles and stimulates the muscles to grow, and that will combat the muscle loss that you can get from the medication as well as from aging. Aging also causes muscle loss.
Oh,
So.
I was gonna stay away from that one as well as aging.
Mhm. I mean,
Uh,
but that's one of the reasons why
yeah.
people say, oh, when I didn't used to be like this, but then like I got older and then like all of a sudden it feels like everything's falling apart. And part of that is also the loss of muscle mass.
Mhm.
It's very subtle at first, but actually we know that muscles produce their own hormones. And so that regulates actually a lot of things in the body, not just your weight and your nutrients. And so it's important to have healthy muscles. So.
No, absolutely, absolutely. So I mean, with the last 5 minutes, any last words you want to give to anybody as far as their interest in this medication or anything?
Yeah, so I think they can be very good medications, especially when used under supervision by a medical provider. And I believe that I know at least like the UMR insurance covers them. I don't know the other insurances that Mount Sinai provides, like if they also cover them. I think some may do, but at least I know for now UMR does. And so if you're on UMR, like, I would say take advantage of it. And like, if you're thinking about starting it, like, you should seek out a, provider. Could be me, could be somebody else who can prescribe this to you and monitor you on it. And, so then that way that can kind of help you start in your journey and, get to a healthier place, basically.
Absolutely. Thank you so much, Dr. Ng, for
Mhm.
taking the time to share this information with us. I'm thankful for everybody who is here to join today. I am
Yeah,
Sean. I'm a co-lead of Heritage of Latinx Alliance. We do these events all the time. I believe if you look in the chat, Katari Villanueva, who's one of our leads, put information on if you want to learn more about joining an employee resource group or learn more about the Office for Diversity and Inclusion. You can reach out there. Thank you to the Office for Diversity and Inclusion for providing this platform for us to have this conversation today. And listen, in the words of my good colleague Frank Pabone, it's either one day or day one. You choose when you want to change anything about your path forward in life. And if weight management is something that you want to change, today's a good start to use the information you learned to get started. With that being said, I thank you all for giving us this time out of your day. I know we're going back to regularly scheduled programming, but we'll see you all next event. Everyone have a great day.
Okay, thank you, everyone. Thank you for having me here. So,
Thank you, Dr.
all right. Okay, take care now.
Take care.